Rituximab maintenance has been shown to extend progression-free survival following several different induction regimens. And we saw from the PRIMA trial, which we actually saw at this 2017 American Society of Hematology meeting, a long-term follow-up of the PRIMA trial was frontline rituximab plus chemotherapy, followed by one of two arms. It's a randomized trial. Patients that responded to induction chemotherapy with rituximab were randomized to receive rituximab maintenance for 2 years versus observation. And Dr. Gilles Saul showed that there was a significant prolongation in progression-free survival with rituximab maintenance. Now at this meeting we saw an extended follow-up of that trial where they presented 10-year data showing that patients that were on the rituximab maintenance arm, about half of them actually remain in remission, which is pretty exciting. I mean, it shows that, again, using an induction regimen followed by a fairly short maintenance schedule, 2 years, about half of patients could attain very durable remissions. We also saw at this meeting data from maintenance rituximab studies following bendamustine-containing induction regimens. And this is very relevant because in the United States, we've seen bendamustine become really a major player in frontline follicular lymphoma. In the past, there was not a lot of data to show outcomes of patients that received this newer induction regimen, bendamustine, with maintenance therapy. So at this meeting, we saw several different abstracts, one from a subset analysis of the BRIGHT study. This was presented by Brad Call, where they looked at the subset of patients from the BRIGHT trial. This was a randomization trial between bendamustine rituximab versus R-CHOP. And they looked at patients who received maintenance rituximab, including a large portion of patients who had received bendamustine rituximab followed by rituximab maintenance. And in that study, no surprise, they showed a prolongation in progression-free survival. We also saw data from the German STEEL group. This is a German low-grade lymphoma group. The trial was presented by Matthias Rommel, and this study looked at bendamustine rituximab with two different maintenance rituximab schedules. One, 2 years of rituximab, the other, 4 years of rituximab following rituximab induction. And in this study, they also showed prolongation of progression-free survival with both arms compared to historical bendamustine rituximab induction regimens, and a slight prolongation in progression-free survival with 4 years of rituximab versus 2 years. But I think most importantly to me, this whole group of data suggests that maintenance rituximab following bendamustine didn't appear to be significantly more toxic. So we didn't see a very high infection rate. We didn't appear to see any or dramatic increase in death rate with maintenance rituximab following bendamustine. So I do think that, at least with the studies that were presented at this meeting, bendamustine rituximab followed by rituximab maintenance appeared to be safe in these trials in the vast majority of patients.
The phase 3 Allium study has been a very impactful study in follicular lymphoma because it demonstrates that using obinutuzumab-based induction therapy compared to rituximab-based therapy, there is a progression-free survival benefit for patients with follicular lymphoma. I think that the issue with obinutuzumab is that it has been shown to be slightly more toxic, so patients had more infectious-related complications and there were more deaths related to that in the obinutuzumab arm. But I think that it makes an important point that there was a progression-free survival benefit demonstrated. So I think that that will likely change the standard of care for patients with follicular lymphoma. And the aspect of maintenance is an interesting one too, because rituximab maintenance we know has a progression-free survival benefit, and we're seeing that with obinutuzumab the progression-free survival benefit is there as well. So I suspect that this will be practice-changing for most patients with follicular lymphoma.
There was some data from the Catalan trial. This was a trial that looked at obinutuzumab versus rituximab with induction therapy. And in this trial, one arm received rituximab plus chemotherapy followed by rituximab maintenance. The other arm received obinutuzumab plus chemotherapy followed by obinutuzumab maintenance. Now, a subset analysis looking at the bendamustine arms showed an increase in late mortality, late deaths, during the maintenance therapy with bendamustine, with obinutuzumab or rituximab. Again, this was not part of the primary objective of the trial, but again, in a subset analysis, it suggested that there could potentially be an increased infection rate, increased death rate in bendamustine, followed by maintenance obinutuzumab or rituximab. So a lot of us were waiting to see other trials with rituximab maintenance following bendamustine to see if this signal persisted in other studies. And the good news, at least in the trials that were presented at this ASH, we didn't see that increased safety signal.